UCHealth has now joined Denver Health and will no longer provide gender-affirming care for patients under 19.
Of course, this is a decision that comes in response to the executive order President Trump signed this week. And 9 News reporter Jaleesa Irizarry is with us. And Jaleesa, how many people might this change affect?
Kim and Tom, this is a question we have asked both hospitals, and they have not been able to give us an exact number. But we know this directive goes beyond gender-affirming surgery. It includes hormone therapy, which is an option a lot of young transgender individuals often use. LGBTQ advocates tell me they feared this would happen.
Thousands go to Denver Health to get better. For the last few years, Saoirse Maloney,
6 years now,
has visited to feel like herself.
Yeah, 6 years. So I get hormone therapy. All my medical services are through Denver Health.
But not all transgender patients can now say the same. This week, Denver Health announced they will pause all gender-affirming care for patients under 19. That includes gender-affirming surgeries and hormonal therapy, a move that hits close to home for Saoirse.
And I started my transition when I was 18. And I just see this as raising the suicidality rate of trans kids and also trans adults. Like the 18-year-olds are adults.
Denver Health says they, quote, recognize this order will impact gender diverse youth, including increased risk of depression, anxiety, and suicidality. In a statement, they pointed out the financial consequences if they don't comply with this order. The hospital receives $89 million in federal funding that could be at risk.
My biggest question at this time to Denver Health is how much will be too much?
Denver Health isn't alone. UCHealth has paused gender-affirming surgeries and hormonal therapy for their 18-year-old patients, saying in a statement, quote, we support adults' rights to make informed decisions about their own health care. We also have a responsibility to ensure that our organization complies with all applicable laws. Saoirse fears this is only the beginning.
Yeah, I would say it's deeply stressful for sure.
She hopes for those that desperately need this care, she's wrong.
It must be recognized that gender-affirming care is life-saving care. I hope that everyone actually sees this crisis as an opportunity to fight.
The pause has already taken effect at both hospitals. UCHealth says they are helping their patients that are under 19 that are impacted by this sudden change. Denver Health says they're continuing to provide behavioral health and primary care for those impacted as well. Reporting in the newsroom, Jaleesa Irizarry, 9 News.